Hello and welcome to Living in the Lehigh Valley, where our focus is your health and wellness. I'm your host, Brittany Sweeney. Knowing the signs and symptoms of heart disease could save your life. It's the leading cause of death for men, women, and people of most racial and ethnic groups in the U.S., according to the Centers for Disease Control and Prevention. During Heart Health Month, our local healthcare providers are sharing information everyone should know about staying heart healthy.
This is a nice, healthy artery.
Cardiovascular disease is the leading cause of death in the U.S., a surprising statistic to some, according to a local physician.
Women tend to be concerned that breast cancer is the leading cause of death, but it is in fact cardiovascular disease. 1 in 5 women may pass away from cardiovascular disease.
Dr. Elena Feiner is a clinical cardiologist at LVHN's Lehigh Valley Heart and Vascular Institute, part of Jefferson Health. She says knowing the signs and symptoms of a heart attack could mean the difference between life and death.
Any symptoms of chest pain, shortness of breath, lightheadedness, feeling like the heart is pounding, swelling in the legs associated with shortness of breath should not be ignored.
However, the cardiologist says only 3/4 of patients get chest pain when experiencing a heart attack.
Other symptoms of heart attack are jaw tightness, neck tightness, shoulder tightness, tightness across the back, nausea.
She says the incidence of chest pain is the same for both men and women at about 75%, but female patients especially need to know the other symptoms as well.
Women more often have other associated symptoms: shortness of breath, dizziness, nausea. It is common that these symptoms can be mislabeled as something that is not heart specific. This is what plaque development looks like. Sometimes people may think that like a sharp twinge or a very quick chest pain is concerning for a heart attack. It is not. Prolonged symptoms are concerning, and when chest pain or shortness of breath in constellation with those symptoms presents, it's very important to obtain evaluation.
Feiner also says prevention is just as important as knowing the signs, and that begins with how people live their day-to-day lives.
80% of cardiovascular events can be prevented with lifestyle, with healthy lifestyle choices, heart-healthy diet, Mediterranean type of diet, with seafood and vegetarian proteins and fats being the main source of protein and fat, regular exercise, regular activity, at least an hour every day, no smoking, and maintenance of normal weight.
Feiner says people should err on the side of caution if they are feeling symptoms that may be due to a heart attack and go to the closest emergency room.
There is incredible power in the timing. Call 911, call other adults, get people who are able to provide medical care as quickly as possible.
Again, the physician says simple lifestyle and dietary changes can help reduce your risk of developing heart disease. That'll do it for this edition of Living in the Lehigh Valley. I'm Brittany Sweeney, hoping you stay happy and healthy.